Opill norgestrel is a progestin-only contraceptive pill used to prevent pregnancy. Opill works mainly by thickening the cervical mucus, which makes it difficult for sperm to reach the egg. You must take it every day to prevent pregnancy. In addition, Opill may prevent pregnancy by suppressing the release of an egg from the ovary. Opill does not contain estrogen. Every one of the 28 tablets in a blister pack contains the active ingredient, so you must take one tablet every day with no breaks. Opill starts working 2 days after you start taking it, but you must take it every day at about the same time each day for it to continue to be effective. How to use? Take one tablet at the same time every day. This tablet works best to prevent pregnancy when taken exactly as directed. You can start on any day of your cycle. Opill takes 48 hours to days to start working. Use condoms or another barrier contraceptive method every time you have sex during the first 2 days of use after you start your first pack of Opill. Never skip your daily tablet. To prevent pregnancy, you need to take your tablet every day, even when you bleed or have spurting. When you finish a pack, you should start the next one the following day without a break. If you are more than 3 hours late taking your tablet or miss taking your tablet on 1 or more days, take one tablet immediately as soon as you remember, then go back to taking your daily tablet at the usual time. Use a condom or another barrier method every time you have sex for the next 48 hours to days because the medicine may not be effective. If you vomit for any reason or have severe diarrhea within 4 hours of taking your daily tablet, use a condom or another barrier method every time you have sex for the next 48 hours to days because the medicine may not be effective. When do I need to use extra contraceptive protection? You need to use extra contraceptive protection, condoms or other forms of barrier contraception every time you have sex for the next 2 days, 48 hours after you start your first pack. If you take a tablet more than 3 hours late or miss a tablet on 1 or more days. If you vomit or have severe diarrhea within 4 hours of taking a tablet. Take a pregnancy test or talk to a doctor if your period is late after missing taking a tablet in the last month. If you have not had a period for 2 months and believe you might be pregnant, stop using this medicine and talk to a doctor if you become pregnant while on the medication. Contraindications. If you currently have or have ever had breast cancer, if you are already pregnant or think may be pregnant, with another birth control pill, vaginal ring, patch, implant injection or an IUD, as an emergency contraceptive morning after pill, Opill will not prevent pregnancy when used after unprotected sex. If you have any of the following medical conditions, it is best to talk to a doctor before taking Opill. Currently have vaginal bleeding between your periods and you have not already talked to a doctor about it. Have liver problems. Have or ever had any cancer. Are taking a prescription medicine for SAGEs, tuberculosis, HIV, AIDS, or pulmonary hypertension. You are taking a supplement containing St. John's wort, and herbal ingredient. You have taken a leprostol acetate, an emergency contraceptive or morning after pill in the past 5 days. Precautions. Tell a pharmacist about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. Opill may affect the way other medicines work and vice versa. Symptoms of overdosage may include nausea, vomiting, breast tiredness, dizziness, somnolence, drowsiness, fatigue, and withdrawal bleeding in females. Talk to a healthcare provider right away if you think that you are pregnant. If you become pregnant while using this medicine, you should stop taking it and talk to a doctor. Occasionally, taking oral contraceptives such as Opill may increase your risk of having an ectopic pregnancy. This means that the pregnancy is outside of the uterus. Symptoms of an ectopic pregnancy are unusual vaginal bleeding or lower stomach area, abdominal pain. Seek medical help immediately. Opill will not delay your ability to get pregnant. Side effects. Changes in menstrual periods, bleeding is the most common side effects of Opill. Less common side effects include headache, dizziness, nausea, increased appetite, abdominal pain, cramps and bloating, fatigue, vaginal discharge, painful periods, nervousness, backache, breast discomfort, acne. You should talk to a doctor if you have repeated vaginal bleeding after having sex. Your periods start lasting more than 8 days or they are unusually heavy. You start having migraines with aura, headaches that start with vision changes, or if your migraine headaches get worse.